So the MAHOGANY study is a study that is a 2-cohort study. It has Cohort A and Cohort B. What we presented at ESMO this year was Cohort A. And Cohort A is a chemo-free first-line study looking at Margetuximab, which is a monoclonal antibody to HER2 to the same epitope as trastuzumab, but Margetuximab is engineered to enhance an ADCC response, or antibody-dependent cell-mediated cytotoxicity response, to the FC domain of the antibody, and in combination with an anti-PD-1 antibody, Retifanlimab. And so this combination strategy was shown in the second-line setting in a previous study of Margetuximab and Pembrolizumab at the time, in a chemo-free approach, again, in second-line gastroesophageal adenocarcinoma that had failed prior chemo and trastuzumab, showing in all comers a response rate of 18%, but showing in patients who were IHC 3+ before first-line therapy and a PD-L1 score, combined positivity score of 1 or higher, again, before first-line therapy, showed response rates in the 50% range. And so based on that, the Cohort A study was designed in the first-line setting in patients who were double biomarker selected. So they were IHC 3+, HER2 positive. So IHC 2+ FISH positive were not eligible, and PD-L1 CPS scoring of 1 or higher. And so it's estimated that's about 50 to 60% of all clinically HER2 positive patients. And so the primary endpoint was response rate in the first 40 patients evaluable in part 1 of Cohort A. And if the response rate was above a certain benchmark, then that would lead to the decision to proceed with part 2, which was another 60%, another 60 patients in the part 2 component of Cohort A. And so at ESMO this year, we presented the first 40 evaluable patients in Cohort A part 1 for the first time. And what we showed was that the response rate was 53%. And in this chemo-free approach, that the median duration of response was 10.3 months, and that the disease control rate, or best disease control rate, was 73%. And the median overall survival was not reached, and the median progression-free survival was 6.4 months. So these are really promising data in terms of a chemo-free approach, essentially the highest response rate shown in a chemo-free approach in this disease. And so this is quite exciting and encouraging, because when we talk about tolerability of this regimen, again, as expected, and really was in line with what we saw in the second-line study and what would be expected from checkpoint blockade with PD-1 therapy, and there were no treatment-related deaths, for example, and things like this. So in comparison to, say, the standard of care, the TOGA study, and even in the control arm of a recent study, Keynote 811, where the response rates are around this with Keynote 811, and certainly lower with the TOGA study with chemo. And so therefore, really promising for patients, particularly who fit these criteria, who have double biomarker positivity. And so again, this met the benchmark to proceed with the part 2 of Cohort A, and that will be launched in the next weeks. And so we will look forward to seeing the next 60 patients, and if it makes the mark, then potentially could be an option for patients in the first line setting that fit this criteria and would be appealing as a chemo-free approach.